You're watching your local television network, TSPN, and now back to Today's Seniors Living Well with your host, Laurie Webb.
Hi everyone, we're back from break. I'm talking with Ann Platt, who's the CEO of our local Sutter Amador Hospital, and we were just discussing the fact that Sutter Amador Hospital got yet again another award. But this one's a different kind of award.
It is different. It's we were awarded an A rating in patient safety by the Leapfrog Group, which is a national organization that evaluates hospitals all across the nation, and based on a number of factors related to safety of patients. Are we keeping patient safety in terms of medications and equipment and other processes? And we received an A rating. Again, we received an A rating last year.
Oh, that's great.
So, yeah.
And Leapfrog, I wonder where that name came from.
Well,
but wherever it came from,
wherever
we're very happy. So, A rating in patient safety.
Yes.
And just had the Joint Commission in.
We did.
Passed that with flying colors. I heard about that. So
we
that's
did,
great.
yes. And we need that external outside review to verify that we are meeting the highest standards.
Yeah. I think my experience, and of course I'm a little prejudiced because I was on the board when the new hospital was built, but I think we have one of the finest rural hospitals in California. And
I agree.
We're on the cutting edge. So tell us about some of the new things that are going on at the hospital.
Can you believe the hospital is 12 years old?
No.
Yes.
That's amazing.
But we are on the cutting edge, and a lot of that has to do with the amazing staff that we have. You just met Dr. Ponizzi, one of our medical staff members. We have a wonderful medical staff. We also have a lot of support from Sutter Health, which really helps us a lot because we are out of the beaten path, off the beaten path.
Right.
Recently, in the last 4 years, we have introduced a medical hospitalist program at the hospital. So when patients come in as an inpatient and need to be in the hospital, if their doctor is not covering them, we have a group of hospitalists who are inpatient physician specialists, and they take care of patients while they're in the hospital. When they leave the hospital, they coordinate their discharge with their primary care physician.
So this really caused a lot of chaos with my seniors, as you can imagine.
A big change.
A big change. Well, not just with the seniors, with a lot of folks, because people have a lot of propriety feeling about their primary care physician. But this hospitalist program has worked out beautifully, and even the internal medicine group, who I think stayed back from it for a little bit, they've embraced it.
That is true. Last summer, the local internal medicine group decided that they would utilize the hospitalist program for their patients when they're in the hospital so that they could be more accessible to patients in the office, because it's very difficult to continuously run back and forth between your office practice and going into the ICU, which can sometimes take many, many hours. So they developed a comfort level and a confidence in the quality of care that the hospitalists were giving patients, and they asked them to partner with them to take care of their patients when they're in the hospital, and it's been working really well.
Right. Everyone that I've talked to loves the hospitalists because they come in and they spend time with you, and they talk directly to the patient, and they really spend the kind of time that everyone thought Marcus Welby should be able to spend when he was in the hospital.
Ah, yes, Marcus Welby.
Goodbye.
Not everyone knows Marcus Welby.
No, that's true. I'm dating myself, aren't I? So, as an extension of the hospitalist program, or because that was such a successful thing, we've recently added
a surgical hospitalist program.
Yeah.
Some people try to say a surgicalist program, but we call it a surgical hospitalist program. So we have started that as of February 1st. We're working with a group based in Sacramento, and this group has been providing surgical hospitalist care down at Sutter Medical Center, and it's been very successful there, and now we have contracted with that group to provide surgeons 24 hours a day to our hospital, and we're very happy with the quality of the surgeons. We actually are able to benefit from having Dr. Greg Graves, who is the regional director of all oncology services for the Sacramento Sierra region. He is now our interim medical director, and he's working with us to guide the new surgical hospitalist program.
So we get really top-of-the-line support from Sutter.
Absolutely.
To make everything really good. That's wonderful. And I know that there have been a couple of initiatives. We talked with, well, maybe it was on a different media, that I spoke with someone about the stroke initiative that happened not
probably
too long
with
ago.
Tamara Harding, our coordinator of that program. We are stroke certified by the Joint Commission, which means we comply with the highest standard of care for treating stroke patients when they come in to the hospital. We call a stroke alert, and all disciplines that are needed to address the needs of a stroke patient immediately arrive in the emergency room to fulfill their particular role. So that's been helpful.
That's what it was. It was a patient that didn't know that he was having a stroke. If he was having a stroke, it turned out he had Bell's palsy. But he said when he got to the emergency room, it was just like he was descended upon by all these people that were, there to help him and diagnose and do the right thing. So,
well, that's good. That's exactly what's supposed to happen.
Well,
I'm glad to hear that it did for him.
Yeah.
We've also just been able to add a new cardiologist on our medical staff. And since we do have a senior, I would say a robust senior population here in Amador County, cardiology is a service that many people need and will benefit from. So we have Dr. Frank Porgia, who just started about 2 weeks ago, who has relocated here from Long Beach. And we're very happy. Yeah, he's very happy to be here too, and is discovering the wonderful quality of life that we have here in Amador County.
That's great. And so he's a cardiologist. Now, does he have an office? Does he have a practice?
He does have an office. He is part of the Sutter Medical Foundation cardiology office that's over on Court Street in the medical complex. However, Sutter Medical Foundation is building an office space in the hospital's outpatient center so that sometime early fall we will actually have a cardiology office on our campus. So that will give very easy access to the emergency room when we need a cardiologist.
So he'll be there, and if someone comes in with a complicated
cardiac condition,
problem, that he can come down. And I just had the experience of being in the emergency room, not myself, but with a relative, and boy, what changes in the emergency room.
Isn't it amazing?
Oh my gosh, it's so beautiful. It looks like NASA control.
We have more than doubled the size of our emergency room, and we had probably about a 3-year construction project. We're almost finished, and we couldn't have done this without community support. Our community, through our philanthropy board, raised over $1.5 million toward the project, which cost about $7.5 million. So Sutter Health funded the majority of the cost, but without our community support, we would not have been able to accomplish that wonderful improvement at the hospital.
Yeah, I wouldn't tell people go to the emergency room, but if you have to go to the emergency room, I think you'll be impressed with what's going on there. It's amazing. And the community also contributed to, there was some stuff on the OBGYN or radiology, or
every department has benefited from community support. But yes, our Family Birth Center had a program to raise money for new equipment for central monitoring of moms. We actually are welcoming a new OBGYN to the community this month. Her name is Dr. Gail Russell, and she will be joining Dr. Young in the Sutter Medical Foundation Women's Center on our campus, and we're thrilled to have a new female OBGYN.
Right. A lot of women out there will be glad to hear that.
Yes.
That's wonderful. And then the ICU had a really interesting, or is working on a really interesting, and we probably don't even have time to talk about the ICU Liberation project.
It's a new patient clinical safety initiative, ICU Liberation. It's to reduce the amount of delirium and negative side effects that patients can experience from being in the ICU or being on a ventilator and having a lot of medication while they're in the ICU. So it is really cutting edge, and it's funded through the Moore Foundation, has partnered with Sutter because of our advancement in patient safety, and they are funding this ICU Liberation project.
Well, I hope we can hear more about that. We're going to do another series in the fall, and by then that project should have had.
We would love to come back and talk about it.
Great. I'm going to hold you to that, Ann.
Okay, Laurie.
Thanks for coming in today.
Thank you.
All right, stay tuned. We're going to shift gears and go to the garden with Jackie Tartapa.